So I just make this statement. It's truly amazing that even with our human shortcomings, our dentistry does pretty well for the public, and it lasts a pretty long time. So I think that's a point to remember. It's not about being perfect. It's about being excellent and doing good work and continually learning and being compassionate with your work. So, steps to mitigate perfectionism: number one, be flexible, set reasonable goals, talk to other people, ask for help. I don't know. I don't know what direction I want to go to with my practice. I don't like doing stainless steel crowns. I love doing dentures. I don't like doing ortho. I like doing it. Whatever it is, talk to people who are doing that, who are modeling what you want your practice to look like. They can give you valuable insight into how to go forward and not become paralyzed in trying to be perfect. Reconceptualize failure as a learning experience, as I mentioned. Interject other projects between challenging tasks, real important to break up that constant obsessiveness about trying to do. Break it up with I says projects, but you could just take a short ice cream break or go to a movie or do something to break up the stress level. Don't just constantly stay in a matter of total excitation during the day. Realize the task is excellent without it being perfect. And I know you can't go to the movie during the patients, but I'm just saying, when you're doing projects at home or in dentistry, just break up your time. Realize it. Look at the bigger picture. Realize the task is excellent without it being perfect. Certainly, accept the degrees of failure and successes. And I would say that certain degrees of failure actually ours is a degree of success because we know we can't reach that impossible goal of being perfect. And then celebrate your successes. Go out and do something fun for your staff. Go out and do something fun for yourself. Enjoy life as you go along. And then seek clinical excellence, not perfectionism. So I end by just saying it's easy to see how the demands and stresses of dentistry can predispose one to psychiatric illnesses, perfectionistic tendencies, OCD routines, and alcohol and drug abuse and dependence. So I thank you, and I'll turn it back over to you, and you can tell me if we had any questions. I don't have my screen on. There we go. If anyone has any comments or ideas or um, anything they'd like to talk about around this subject, I'd love to start the conversation.
That's that's great, Bill. One of the first questions that we got was, how can I give myself grace when something doesn't go 100%?
How do I get my what?
How do I give myself grace when something doesn't go 100%?
Yeah. Yeah. Like everything.
Yeah.
Well, I mean, again, I think you have to feel, first of all, comfortable with the procedure you're doing. You don't want to just start saying, well, I hear apicoectomies are fun to do. Let me try one today. You want to prepare yourself as much as possible. But when things don't go well, realize you're human. Ask for grace, ask for wisdom on how to move forward. I think also you have your side of talking to others that maybe preparing yourself next time for it if you're going to do that procedure again to try to mitigate some of the effects of that. Talk to, say, someone who maybe has done that procedure more than you have, or someone you trust who maybe teaches that procedure, and say, "This is what I ran into in this case. Help me to learn what I can do next time." That learning the journey thing kind of thing we talk about. You're on a train and you're kind of going through life. We want to learn on that train with others. We don't want to just jump off and say, "I can't do this." And so you need to really feel like you can have a mentor, have another colleague. If it's a specialist, if you're doing it, say endo, uh, visit an endodontist. Tell him you're going to refer all the cases to him unless he tells you how to do this better. I mean, all these kind of things. They want you to learn. I mean, I really think the more we do, the better they're going to get. So it's an altruistic kind of relationship we often find between generalists and specialists. So I don't think, some may say, "Oh, send me all your cases," but I think most of them want to truly help us. And so I think most dentists have that attitude of really wanting to be giving and helping others. So don't sell yourself short. I think others really do want to help you. That was one of my things in my burnout story. I kind of shut down because I didn't want to ask for help. It was a sign, I wouldn't say it was a sign of weakness. It was a sign that I didn't know something. I mean, I didn't look at it as like a weakness, but like I should know that. I'm self-sufficient. If I tell them that I don't know this, it's going to make me look really bad. Yeah, I was kind of in that stuck in that realm. But people want to help others, so I would say, ask ask for grace first, and then ask around. How can I not have this happen again? What would you suggest?
So, having gone through burnout, Bill, what would you have done differently? I know you just said you'd ask somebody for help. Were there other things that you were identifying along the way? I know, there can be things that are, what you've already talked about, but are there things that really happened in your own life that you would have said, I should have put a finger on it before it got to this point?
Yeah, you know, pride is a good thing and it's a bad thing. And I'm sure there's some on this meeting that can identify with this. And I'll just say it bluntly. I went to UNC at the time when it was the number one dental school in the country, and number one, right? You know, we're the best, and they don't take you unless you are the best in there. So I had a lot, like we all had on our shoulders when we went to school, and I think when I didn't know something, I did look at it at the time as a sign of weakness. It was like vulnerability is going to be showing here. Somebody's going to say I'm stupid. So I was kind of internalizing what you thought of me if I had to ask a question. So I would shut down. I would isolate. I would not ask for help. And the most amazing thing when I kind of got on the other side of burnout and started healing was that when I would ask you for something, you would help me. When I'd ask another person for help, they would help me. And I'm going like, what's that about? I would never help anybody because I wanted to keep it all myself. I was very possessive, very self-centered. It was like I'm responsible. I mean, I am a baby boomer, right? I mean, I'm self-sufficient. I came from that generation where you had to take care of yourself. And no, you didn't ask for help. You basically pulled yourself up by the bootstraps and you did your thing. Uh, Lord, when I started asking for help, I couldn't stop. And then I found out that everybody wanted to help me. And that was a great thing. And that's one of the beautiful things about the dental community. It's such a dichotomy. If you think about it, we think a dentist is isolating, competitive. They never talk to each other. You're stealing patients from me. But really, the opposite is true. When you get to really in a relationship and clubs and knowing people socially and stuff, they want to help you. They really do. We help people all the time. And I think sometimes it's not about what we can hold on to, it's about what we can let go. And I think that is so and give back to other people. And that's what I experienced. That changed my burnout experience. And so the floodgates opened up and I couldn't stop. And it was just like, these opportunities just started happening. People were giving me answers to my problems that I was having. I was going like, my gosh, why did I wait so long to ask for help? Because I thought I was supposed to know all the answers.
That's good. That's good. So I've got another question. Despite my efforts, there's always something I can find wrong with pretty much anything I do. It feels self-defeating to continue to try and deliver exemplary results, but know that there is always some way that I or we came up short and could have done better. Thoughts?
We're human.
Yeah.
You don't have to be perfect to have good dental work. You don't have to be perfect. Obviously, like we said, you don't have to be perfect. You have to do good, clinically sound, uh, you know, research kind of procedures that are based in science. And yeah, you're going to have shortcomings. I mean, yeah, every crown I've ever done never fit perfectly. It never will. I had some of you may have known. I had in the last 10 or 12 years of my practice, I incorporated digital dentistry into my practice. And one of the questions that we had a professor that used to teach over in Charlotte, he was from the University of Michigan. He used to teach CAD CAM there at the University of Michigan. And one of his questions, he had asked a class, every class, he says, what is the clinically acceptable marginal gap of a crown, of a good fitting crown? And, we'd all give the Gordon Christensen 80 to 120 microns, and he'd say, okay, let's stop there. Let's say 120, let's say 200, let's say 80, whatever you want to say. I said, now, what is on a bonded uh, digital milled crown? What is the marginal gap? And everybody go like, well, 20, 10, and the answer is zero. There's no gap because it's bonded. Do they
Hmm.
still fail? Yeah, they still fail. Why do they fail? A lot of reasons. So it's not about our perfection. It's about our compassion, our care, our trying to do the right thing and doing as well as we can. I mean, I've never had anything that I've done that, well, I won't say anything, but there's rarely, I can always find improvement, room for improvement, and that's okay. That's the striving. That's the continually thriving to educate yourself to be better and better. You never get there, but that's okay. You never get to the goalpost. You never get to the goal line. You're always getting half the distance, and that's okay. At least you're going that way and not being penalized and penalizing yourself going back 5, 10, 15 yards every time. So if you think of it that way as I'm close, but that's my humanness. I accept that. I can accept a certain degree of imperfection. So when all the glasses don't line up in the cabinet where the door doesn't completely close, you don't have to go back and change it every time. Try it. Just see what happens. It's going to be okay. The world won't stop. And as silly as that sounds, we all have things in our lives like that. We want to touch this up or move this over or do this again. I mean, I'm the world's worst at that, but I realize it's okay.
It's
I
good.
don't know if I have any other ideas. What does the audience think? Does anybody have any comments on that?
Mark mentioned something here, and somebody else, go ahead and type in, but he said situational perfection. So this is this part of it, the aspect of situational perfection. We can't always control everything, and there are times when a situation prevents us from doing our best work. It is our best, though, because in that moment, we work to be as perfect as the situation allows. Sometimes we must work harder in those cases and achieve less. It's okay.
Yeah. I never will forget, and I don't know how many UNC grads we have on here that are of my vintage, but I never will forget Cliff Sturdivant used to always say, never judge another dentist's work because you don't know what conditions he worked in, what handicapping situations he had to work with, what kind of patient he had to work with at the time. You may see that patient, today, and 10 years ago, that patient may have been totally different in a different situation, and the dentist was handicapped to a certain degree in doing the procedure. So I think we're quick to judge, and we're quick to judge others, but quick to judge ourselves because we're not perfect, and that's just it's okay.
Hmm.
That's why it's our friend and our foe. It can be as long as it's not narcissistically paralyzing us to a degree where we can't function. I told you earlier that there was a dentist I talked to recently that couldn't get out of his house for 2 months because he's afraid he'd make a mistake at work.
Hmm.
You say, how does someone get to that point?
That's good. That's a good point. Well, I did say that we would hold to time, and it is 9:01, I believe, right now, 9:02. If you'd like to stay longer and have more of an open discussion with Bill, he said he would stay around for some additional questions. I do have about three more questions, Bill, but if someone else that's here would like to share them, I'd love to get those. So I'm going to allow everybody to unmute if you want to go ahead and ask, or and everybody else, you can go ahead and go. That's at 9:02. So thank you all for showing up. And just a real caveat, I did say if you would allow me to be your coach. So maybe asking yourself the question, what's one thing I can do as a result of the information that Bill shared, such that by doing it makes everything else easier or unnecessary as it relates to perfectionism in your life. You were here for a purpose, and I'm so glad you came. So maybe thinking through some of the things, the solutions, or maybe the conversation here, what can I do? Is it reach out to a peer or a classmate or somebody that I could go and ask about procedure that I want to learn, or, asking for help, just like what Bill said his first step was. So I'd love to encourage you to think in terms of what's the actionable thing I can take away from this? And if Bill can help, I'm sure he's there to help. And we're going to get the book to everyone. If you would just email me so I know who was here, audie@dentalonething.com. I'll type that in here. We'll get you a copy of Bill's book. Uh, and if you'd like to unmute and ask a question or put another one in here in the chat, feel free to do so. One of them I thought was a great question is, why is there so much perfection why is it such a big deal in dentistry? Why do you think there's so much perfection and such a big issue in dentistry?
Well, I think we tend to be as a personality, a lot of our personalities kind of fall into the isolative type of category where we're more detail oriented. We tend to be with the term perfectionism. I think we look at things. Our training sets us up that it's like one way or it's one way or not that way. It's either yes or no. You don't pass unless you do this. I mean, we all have stories of clinic and dental school, and I think it started early, but I think it even starts earlier than that. I think it starts back in our education from kindergarten on up to where, a lot of us, and I know most of us in this room, were the ones that got the A's and the accolades and all the awards, and we constantly had that affirmation that we were good and that we were wanted and you were respected because you did this and you accomplished that. When you get to dental school, and then it's like it's this way or that way, it's nowhere in between. Um, it becomes like okay, and so you have that studies have shown that evaluative judgments of other people really drive this, not surprisingly, where people are constantly you're under evaluative judgments. And dentists are look at dental schools a lot of times are looked at as checkers. We check people's work, and if you have three different instructors that check the same work, you might get three different opinions or two opinions that agree and one don't. And so you get this whole thing of like trying to please. You're constantly codependent. You don't want to you want to be accept. You want that stroking like a dog. You don't want to be petted. You want to you're good. You're doing well. The problem is when we get out in private practice and we have these situational stressors come up in our daily routine, we tend to get aggressive, and we tend to either avoid the conflict or we tend to become overreactive, impulsive, anger. We tend to, the old stories about dentists throwing things or saying things in front of patients, and we tend to have this kind of violent talk or violent action sometimes. Not all of us, but we've heard stories about dentists, throwing instruments across the room, kicking holes in the walls, and throwing dentures in the trash can because they're mad at the patient. All these things, and so it tends to build up over time. And we love control. We love to be in control, but yet we're really not in control. We just think we are. But sometimes having that perception of being in control of the situation gives you a kind of an upper hand. And so when perfectionism is challenged or we don't reach perfectionism, we feel very defensive and we shut down, and we kind of we're very territorial, if you will, tribal, if you will. And that's
Hmm. Yeah. Starting even before dental school, it's kind of the way dentists are wired, it sounds like, is what you're saying. Really
yeah,
driven, really successful. And then
yeah.
dental school does some things to you that causes you to be even more perfectionistic.
And then when you get out, you don't have the professor or somebody saying good job or bad job. You're on your own, and then no one's giving you that affirmation that you're doing well. And sometimes that can internalize not into perfectionism necessarily, but into frustrations of pressures and stressors. And then when a patient comes at you, you can be overreactive and not really respond appropriately. That what I call the ready, shoot, aim syndrome. You
Hmm.
instead of ready, aim, shoot, you say things you wish you could take back or not say or done differently. And I'm not saying every dentist is like that, obviously, but we do have some of that in our DNA, if you will.
It's very real, very real. So what steps can dentists take to begin accepting clinical excellence in practice and letting go of perfectionistic, paralyzing tendencies? I think that's really the slide that you put up there. If we want to go back to that, maybe people could take a screenshot of it or whatever. Does that sound good?
Yeah,
Because I think that's a great slide to be able to keep and have, um, for reference later, and where can I have that? What about how is burnout related to perfectionism? I think that's a great question.
right. Let me just say one thing about overcoming
Yeah, go
perfection.
ahead.
With all these ideas here, I think it really starts, and maybe I should put this in here. It really starts with building a relationship, I think, with another dentist, another colleague, to tell someone else, this is what I'm experiencing. Do you feel this way? I mean, be vulnerable to somebody. You think vulnerability is going to destroy you or your image or your career, but research has shown that the dopamine rush when you get from somebody who's accepted you and can relate to your vulnerabilities has has more power, a lot of times more powerful than a drug. I mean, it's that human connection thing. So I think I remember for years I used to go to lunch with a dentist like every 2 months. Another one I'd meet 3 or 4 times a year. Another one we'd always stay in contact and talk about things we were dealing with, and it was amazing how we all had problems. It's not just me. Burnout, how does it? So basically, what happens is that burnout is like, it's I think of burnout sort of like as an inflammation that has not been addressed appropriately, and it's always an inflammation between the workplace and other people. I mean, what we're talking about burnout, clinical burnout with emotional exhaustion and depersonalization, and oftentimes reduced work performance. But we see this exhaustion occur. We see how you constantly are mentally stressed and you can't focus anymore on what you're really doing. You become paralyzed, as I've said before. And so it can actually have a negative effect on your work and be the opposite of it's like you're going backwards from perfectionism because you think I have to handle this. And so that's why I'm saying talk to other people, have other colleagues that you trust. The old adage, physicians are colleagues, dentists are competitors. It shouldn't be that way if that's really the way it is. So we need to have time together, talking over our failures, our successes. But burnout, if it's something that you are constantly being stressed over and over and over to where you're constantly producing cortisol and all these other chemicals in our body, and you're totally overwhelmed, you can actually become very, overwhelmed emotionally, mentally, and so you become almost paralyzed. The ADA did a study back a number of years ago where they looked at 35. I think it was a study of about 3,500 dentists, and in that study, those in that study who identified dentistry as moderately stressful to very stressful, severely stressful was the term they used. Of the 3,500 that answered this survey, and it was a survey, it wasn't a research project, but it was a survey. Of those 3,500, um, they identified that almost 60 days out of a year, a dentist was considered to be what's clinically termed disengaged from practice, which means they were at work. They were physically, he or she was physically at work, but emotionally, mentally, they were not there. They were forgetting things. They were not starting new treatment. They would isolate. They just shut down emotionally, mentally, and sometimes physically. So consequently, over time, they became burned out. So the stress, unaddressed stress that continues to go unmitigated or unaddressed, I should say, is going to lead potentially to a burnout situation, which we've talked about before in other talks and stuff. But it can be very paralyzing. That's procrastination leads to paralysis, which leads to isolation, and that's also true in mental health and substance use too. When you feel challenged, you want to isolate, you want to shut down, you procrastinate, you isolate, and you don't come forward. So this burnout, substance use, mental health, all this together kind of plays a role in how we react to stressors. And so, again, the first step is building connections with other people. Don't try to figure it out yourself because I don't know about you, but I was not good at that.
Yeah, absolutely. I've got two more. Like one is a question. It's going to be an anonymous question, and the other one is kind of an observation, and maybe you have some thoughts on that. Some conversations going back and forth in the chat, which I think are great. So the question was, "Good evening. Thank you for hosting. I'd like to ask a question without revealing my name to everyone else. What is an employer's appropriate response to an associate dentist experiencing burnout? What is an employer's appropriate response to an associate dentist experiencing burnout?"
Well, first of all, just as a disclaimer here, I'm not a therapist. I'm not licensed to give anybody any kind of clinical advice, but I would tell you what I would do. Um, I've actually had this happen in my practice with a front desk person that was kind of going through this thing, and I remember and I'll just tell you what I did, right or wrong. Um, and like I say, I can't give advice clinically, but I sat her down and said, I've noticed some changes in your behavior and I'm concerned. And, what would you like to share with me? And I just left it open like that. And she went on expressing what was going on with her, some physical stuff, medical stuff going on. And she was just emotionally shut down. She was, had, she was, it was obvious signs of burnout. And, I personally offered her some help to try to get her some assistance. She found some other means of getting help, not through my suggestions, but she did finally get some help and is doing well today. Unfortunately, I did not. She left the practice because she was really at a standstill with her own self. She couldn't function. I mean, she was just totally emotionally hopeless, helpless, blunted, just gone. So it's very difficult, but just giving them I mean, I said, this is what I observed, this is what I see, and what would you like to say about it, and give them a chance to talk, and they did, and I think just letting somebody have an opportunity to share with you what's going on. But it's very difficult. I'm not trying to pretend I have the answer or that was the answer, but I'm just saying that that's what I did, and it seemed to be helpful. And we're on good terms today, and she's doing much better. So maybe she just didn't need to be in dentistry.
Well, and Bill, would somebody, and I don't know where they're from, and I won't mention obviously names or anything, but would they be able to call, North Carolina during, your caring services to be able to reach out if they're an associate? Was that something that they could do, or where could they find help, maybe from a therapy's perspective,
So
confidentially?
so they could call us and we could give them resources of places that the associate dentist maybe could receive help. Yeah, we do that. We've done that quite often this year with a lot of dental colleagues, dentists and hygienists who uh, need help. We see a lot of we're seeing a lot, especially since COVID. We're seeing more and more mental health issues than really predominantly substances. They're still there, but it's mainly help for mental health, burnout, just totally not being able to deal with life on life's terms, stress, things like that. And so we can be a resource for that. We don't obviously treat or anything like that, but we can offer resources where they can receive help.
So what is the main number, or maybe would the website be better for them to reach out through, or
Yeah, the all the information's on the website. I don't have my number. I don't have the
that's all
number.
right.
Uh, but the nccaringdental.com, there are resources there if they're having issues with an even though we do monitor and advocate for dentists and dental hygienists who are suffering from mental or drug substance use. We can help those who are like assistants or front desk people that might have even children if they have children that front desk people that work at the front desk or assistants or even hygienists or so anybody that family members, we can be a resource for help, and we do quite often get involved with that, but we don't do the monitoring and advocating except for dentists and hygienists who have issues with substances or mental health issues.
Okay. One last question was actually a conversation that was going on. So Bill Williams from Georgia, from Atlanta, great person. I know you know him as well, I believe. And he was talking about one of the initial points was a lot of the groups that are out there, either Facebook groups or the other professional groups, they can really just be like antagonistic, and tearing down each other and things like that. There's just a real kind of, anything that you put out there that doesn't seem like a place of being able to, really be able to be safe with asking a question or doing some of that. But then he also brought up the point that study groups are a great way to overcome perfectionism, focusing on, learning together rather than being criticized by one's dental neighbor. And he said much of the time in his experience is, if you dig deeper into whatever that specialty is, you can get mentally involved. You can have that high interest, which leads to focus and sticking to it, helps you get results. Then you're more confident in what you're doing in your specialty, kind of that thing you're niching down in.
Mhm.
He also mentioned, study groups are great. Locally, sometimes it can be challenging, but if you go regional, that's even better. But even national, even better, because then you're not competing with each other. So you can have more of that freedom to freely interact with each other about things that you're dealing with in a safe environment. Some observations on his point. What thoughts do you have around that? Anything that triggered
Yeah.
something for you, Bill?
Yeah, I mean, I think that's a great idea. I will say, and again, just as a, disclaimer here, I'm not a therapist, but for me, I think dealing with issues where you become either paralyzed in your thoughts or you can't get past a certain thing. I think one-on-one counseling is a great place to start with a clinical therapist
Mm,
that can work in this area one-on-one because a lot of times if they can't help you, they can direct you in the right direction. And I think starting the conversation, sometimes you can't talk about certain things with groups, like Bill said. I mean, you can't bring stuff up in big groups because people may feel uncomfortable about you know, a controversial thing, or you know how people are. We're very territorial, if you will. A lot of dentists, and that's a general stereotypical statement, but we are, and we all have our ideas about what works and what doesn't, and sometimes you just need a third party, kind of a non-involved party to listen to you that can give you direction on how to get out of that kind of perfectionistic thinking or details. But I'm all for sharing in dental groups too. I mean, I think that's how you learn and being open. I can remember, I'll just tell this real brief story. I can remember um, when I got out of Chapel Hill, and, I'm going to talk about Chapel Hill because that's all I know. When I got out of Chapel Hill, we were number one this and number one that, and everything was number one. And this back in the 70s, right? So I mean, we got it going on. So anybody else that went anywhere else didn't quite get what I got, right? So I'm very narcissistic, very proud. And when I went down I won't say where I went, but I did a GPR. You can look it up if you want to. Great people down there. Really enjoyed my GPR, and I'd do it again. But when I went down there, they had a whole different idea about what a crown prep was, what the proper crown prep was. And I'm going like, well, you're wrong. You're wrong. You're wrong. No, I mean, I went to the number one dental school. Your school's not even ranked in the top 10. You see where I'm getting, you see where my mind was at the time.
mm,
And then when I got down there and the guy said, just listen. And I thought, okay. So I listened and it made sense what they were doing. And I thought, maybe there's two ways to do this. And so being open to change, embracing the concept of change. And so I think I'll misquote this, but Winston Churchill said something about the pessimist sees a problem in every opportunity, and the guy sees an opportunity in every difficulty or whatever. I just think sometimes we think we know, and it's my way or the highway, and we're very compartmentalized, where physicians tend to be more in groups, collaborative, global thinkers, willing to wait for long periods of time to get results. A lot of times in cases, we're more like checkers. We, do this procedure, go to the next thing. Do this procedure, go to the next thing. We get immediate gratification and fulfillment. And when it's good, we feel great. When it's good, we feel great. When something goes wrong, we can't give ourselves grace. And then we have a bad day, and then it affects the next procedure. And then you get the point. And so it just kind of, we I don't know. It's our name. I mean, we're a lot of us are IT. What is it? IFNPs and ITS. All these Myers Briggs. We're a lot of introverts and a lot of thinkers and judgers and intuitive. And so we should know this stuff. And we
mm.
are and no, we're not. And that's what we think we should be. And I think a lot of that's in our training, but I think a lot of that has changed in dental schools today because as you know, I do go into the schools now and speak to the students, and it's a little bit different environment than it was. Not good or bad, not right or wrong. It's just different, and hopefully, in the long run, it'll be for the better. But back in our day, when I was in school in the 70s and 80s, it was like militaristic. It was this way, and if you didn't do it that way, it was wrong.
Mm.
Um, I will tell you, if I may, just tell a real brief story.
Yeah.
I won't tell the dental school. It wasn't in North or South Carolina, so let's just get that clear. But I have a friend of mine who's a professor at a Midwest school. That's a very prominent Midwest school that you probably have heard of, a dental school. And so he told me the story recently about a dental student in his third year who was doing a crown prep on number 30. And he did a crown prep. He put the temporary crown on, left, came back a week or two later, whatever, and put the permanent crown, the final crown on. And it didn't fit. So the instructor went in and said, look, the margins are open. It's not closed. It's. And he goes, I want you to take another impression, start it over, do it again. So he did it again. And the second time it came back and it didn't fit again. He checked to the same guy. He says, it's still not fitting. And he said, who's doing your crown work? And he said, well, I sent it off to this lab at the school. They have a lab, I guess they contract with. And he said, I want you to pour this up, saw out the dies and trim the dies yourself, wax it up, do the whole thing. And, he said, okay. So third time he came back and he put the crown on and it fit even worse. So the instructor asked the guy, he said, did you do did you pour this up? Did you trim the die? Did you make the crown yourself? And he goes, no. And he says, didn't I ask you to do that? And he says, yeah. And he said, why didn't you do it? And he said, well, look, he said, it was spring break. And me and a couple of guys, we had a house in at Fort Lauderdale that we rented out from Thursday to Tuesday or whatever it was. He says, I wanted to go. So I just sent it to the lab again. And it came back and it didn't fit. And the guy says, well, I need you to do it again. He said, look, my parents pay a lot of money to this university. This is good enough. And the instructor met his match, and the instructor told him, he said, well, this is what's going to happen. You're going to do it again. And they looked at each other and he said, yes, sir. And he did it again. And the fourth time he said it actually did fit.
Wow.
We're in a different world today.
Yeah.
My world would never had that scenario in it when I was in school. It was like, yes, sir, or yes, ma'am, and you did it. But it's a different environment and we have different challenges today with this, and I'm not saying everybody that's in school today is that way. I'm not saying that at all. But I'm just saying there's a lot of what's clinically acceptable, what's not, what's perfect, what's not, back and forth. So again, at the forefront of all this is your compassion for your patient, letting them know that you're, with them. As we know, we try to be part of their uh, solution and not just a mechanic that comes in or a robot that does a procedure, says, bye, pay me, leave me alone. We try to be part of. And so we all have that compassionate side that we need to never forget about. And also the human side that we need to never forget. We need each other. We need other dentists talking to the dentists. We need hygienists talking to hygienists. We need clubs to get back pre-COVID levels, even pre-COVID levels, because now everybody wants to sit at home and do things like we're doing now. But sometimes this is appropriate. But study clubs in the area really need to keep thriving and keep going, because that's where we get relationships built and health brews in those areas.
The human interaction. I love that. Well said. Well, everybody, thank you for coming. Bill, thank you so much. A great presentation. Great questions, everyone. And you just shoot that email to me. I'll get you Bill's book. And if you have any other questions, we can make sure that he gets them and answers them, through this chain. So thank you all for coming. Bill, well done.
Thank you. Thanks, everyone.